Good morning, Illini. Welcome back to another Healthy Illini podcast. I'm your host, as always, Matt Schrock. And today we have an episode that is a little bit different from our usual fare. A lot of times we do a lot of health as far as on the medical side or well-being in that realm. But today we're talking with University of Illinois Police Department, and we're talking about some safety things, and that's certainly a part of your health and well-being. And so I'm excited to have this conversation. There's some really great information, some things I'm going to learn as we go along. And our guests are here, and so let's introduce them. Today I'm joined by three guests who are connected to UIPD in some way. First up is Megan Cameron. She is the Crisis Outreach Coordinator with UIPD. Megan, thanks for being here.
Thanks for having me.
Also joined by Detective Pete Malinkovic. He is a behavioral health detective with UIPD. Pete, thanks for being here.
Thank you. Happy to be here.
And then we're also joined by a student who's involved with UIPD. Maggie Sanchez is a sophomore majoring in psych, and she's come to talk about her role and kind of how it connects with UIPD. Maggie, I appreciate you coming on the show.
Thank you.
So I love being on our campus. I love this campus. I always have. Working here, I like to walk it. I like to see the various places that are here when the weather's nice, those pockets we get in the spring. But when it's nice to walk on campus, it has so much personality. It has so many spots that I enjoy. And I'm proud of being a part of this community. And one of the things that we do as a whole on this campus is we work really hard to keep people safe and to educate people on how to stay healthy and safe in a lot of aspects. And someone might not think of the University of Illinois Police Department as being one of those units that works hard on educating for safety. We think a lot of times with police departments or fire departments or emergency medical professionals, it's always when something bad has happened or there's a crisis of some sort. But there's a lot of things that go into prevention and going into education to help people know what to do or how to stay safe and things like that. So I want to talk about a couple programs that you have that are involved with UIPD, and we're just going to run through them a little bit, and you can share some pieces of each of them. But the first one is COAST, C-O-A-S-T, which stands for Community Outreach and Support Team. So we'll just, very basic question, what is COAST and what does it do?
COAST was developed in 2021. It was kind of revamped. It was something we had dedicated officers to in the past, and it kind of got faded away with just reshuffling with investigations patrol where we were going to allocate all that. And again, in 2021, it was kind of revamped and just deeper developed. And it's exactly what you said earlier. It's all about educating the community. We provide kind of safety talks or anything from very formal briefings to like 100 or so people to small faculty and staff groups. And some of the topics we cover are campus safety, crime prevention, non-escalation and de-escalation skills, alcohol safety, emergency preparedness, and then active threat response as well. Those are kind of the main topics we hit a lot. But again, if someone reached out and had a unique kind of training where they thought like COAST could assist with that or come in and speak on that, we would facilitate that too.
So that's kind of a really broad overview of what you do, which is what I asked for. But could you give me an example of what a training might look like? Like, do you go to the people? Do they come to you? Is it a lecture? Is it a lot of hands-on? Like, what is rubber meets the road part of this?
Yes. So the UIPD website basically has a request form. So just for formality and tracking purposes, a lot of the requests go through there. Through Detective Hurlis, then she kind of reaches out and sees exactly what kind of intimate details they have of what training they're looking for. Based off that, we develop kind of what team is going to go and what. Do we send a comfort canine for this? Is it something that falls in a wheelhouse where we need like a strategies and tactics officer? A good example for that is I do a lot of the active threat training. So we would go and it was just a PowerPoint that kind of talked about mindset. And a lot of the feedback in the Q&A we were getting was, hey, this looks great as a PowerPoint, but this is almost a little more rattling when it's just that. Like you're throwing some heavy topics out there, right? And I'm like, what do these look like in reality? So we kind of came back as a team and said, for these future requests, how can we change and better, facilitate the needs for what the people are looking for? And so we developed a whole new like workshop that's hands-on. So it's a 2-hour thing, and it can be vamped to large amounts or small groups, and it basically goes into the run, hide, fight model and creates hands-on workshop training. So when we say, hey, you're going to have to barricade the door, while you're waiting 3 minutes for officer response. But what does that really look like? So we show them like extension cords you can pull out of the wall and use to barricade the door. We teach them how to tie basic knots that will hold no matter what. We show them basic, like for the fight model, how to take down someone, 1 and 2 person takedowns and the sprawl method and stuff like that. We go hands-on and have them walk through with that. So that's like one good example of, there was a request from the community that they wanted specific training, and then based off the Q&A of what we were doing, we saw there was a need for more. So Coast was able, we have that opportunity. We're not just like bogged down by patrol where we have everyday calls for response. We can dedicate that kind of time and really get in there and facilitate the training to what people really desire.
I like that you mentioned that, you're talking about heavy stuff, because it's part of why we do Helping Illini as well. We've had some episodes that are heavier, tougher topics to talk about. And I'm of the mindset that the ones that are the hardest to talk about are often the ones that are most needed to be talked about. Mm-hmm. And so you have to find those ways to make them relatable and to make them digestible, because you are talking about very serious matters. But it needs to be talked about because you'd rather have those serious matters and have those tools for, God forbid it ever does, but if it ever was needed, hopefully you never do, but you'd rather have it, never need it, than need it, not have it. So, that's a really an important aspect of what Coast does, is gives those tools for the hopefully never, but possible event of something going on. Mm-hmm. You mentioned one thing that you work in conjunction with, and sometimes when you're talking about heavy topics, it's just nice to have them there, and that's your canine units, because there's, therapy dogs are therapeutic in lots of ways. So would you talk a little bit about your therapy dogs? And this may actually transfer over to the next program that I want to talk about, because they're kind of in conjunction, because nothing's siloed when you're talking about these things. Everything is interacted. But the second program I really wanted to touch on is the REACH program. So we talked about Coast, now we're heading to REACH, which is Response Evaluation and Crisis Help. And I know that's where the canine units really come into play there. So would you share a little bit about what REACH is and kind of how it functions?
Sure. So REACH was developed about the same time in 2021, and it's what we consider a true co-response team. So we have social workers who are partnered with specially trained officers who are trained in what mental health is and kind of what it isn't, and how best to respond to somebody who's experiencing mental health crisis. And so we partner those folks together as a patrol unit. And so when we get a 911 call for service that really is more related to mental health concerns than maybe a criminal matter, or maybe they're both there, they're a primary response unit to those calls. So they're the ones that go there to address those, the social worker and the specially trained police officer.
So I know you had said it was a joint effort, but that's the key, is the interaction, because there are times where the crisis may be something that's involves law and personal safety and that side, but it's also mental safety is a big part of that oftentimes.
Yeah. So I think that's a question that we get asked, is like, why is it not just a social worker that's going on these calls? And you kind of have to think about, like, these are calls coming from 911, right? And so there is already an elevated sort of crisis or unpredictability, at least, right? At the very least, it's an unpredictable call. So we really, when we thought this out and we decided sort of what this model should look like, we knew we wanted to get social workers there as soon as possible, but we also wanted to do it as safely as possible. And that's where our law enforcement partners come in. They really manage the safety of these scenes, and some of these scenes happen in the middle of the street, on the sidewalk, right, in somebody's own personal home, which, if I'm not familiar with what's in that home, that can be unpredictable. So their main job on these scenes is safety, while then the social worker can really focus on the clinical piece. So we have two really focused specialties on one call that really help sort of address the entire issue.
One thing I wanted to highlight with REACH that you put in the prep work was one of the phrases you used was clinically appropriate response, which I really like that, and that's what that is. But you also indicated that it doesn't just stop with that moment, that intervention or that call or whatever it may be, that you do follow up and things like that. Would you talk a little bit about how you address those needs? Because a lot of times, especially if there's a mental health situation going on, there's follow up that needs to happen for appropriate care. So how do you address that as part of the REACH team specifically?
Yeah. So what we like to have happen is whatever social worker was on scene with you with a client that in that moment will be the one following up with you, if at all possible. And so what that looks like is, usually within about 3 days, we want to reach out again and see sort of how are you doing since then. If it was a suicidal crisis, we want to do another risk assessment of suicide. We know that doesn't just usually resolve right on its own right away. We want to update any plans that we made in those moments. If it was staying home with a safety plan, is that working? Do we need to make adjustments? If it was connecting you with some other mental health provider, how did that go? Are you going to continue with them? If it was a transport to the emergency department, how did that go? What was that experience like? What do we need to do as next steps? And so we really try to focus on additional assessment and planning, and then really connection to outpatient care. Because the way that sort of we work is that if that client is connected and has been to an appointment with the next outpatient provider, then we can kind of resolve it on our end, right? Because that outpatient provider is going to manage it moving forward. But we do like to stay involved until that happens.
Because ultimately, at the end of the day, you care about the people you're working with.
Yeah.
We care for this. I stress that a lot with this university and so many units, that you don't work at a university if you don't care about students.
Yeah.
Care about people. You just can't.
Right.
Because most of what you do is about helping students and young adults and figure out where they're going and on their path, and being a help along that way. And so that's what Reach is about too, is walking along beside somebody in those moments and helping them find what they need to get to where they need to go. Absolutely. Whatever that answer may be. How does a canine unit fit into Reach? How does that work for you?
So 2 of our patrol units that have social workers and specially trained officers also have therapy canines. So 2 of the 3 patrol units have therapy dogs as part of their teams. They're really like a 3-man team. So our therapy canine, Rosie, she works day shifts. She's a little terrier. You'll see her walking the quad and kind of engaging with folks. It's interesting because she's a very small dog, and her officer is a very tall man, and so there's like always like what am I looking at here, right? And Rosie's just like the cutest. She's got a little bow in her hair all the time, and we joke that Officer Mitru should have like a bow on his hat. And
absolutely.
Absolutely. We're really pushing for that. But so they're on day shift, and then Lollipop and her officer Tran, they work second shift, so that's like 4 p.m. to 2 a.m. And so they are often used on these calls for service that are really more mental health related. When it's safe, we don't take the dogs on every single call, but when it's safe, we do like to bring them out because they are, dogs are kind of amazing. A lot of people find comfort. A lot of our students will say they're missing their pets from home. And it's a really nice time to just like breathe a little bit. And there's something very soothing about petting a dog and getting a kiss from a dog and, feeding them a treat and them just, loving on you a little bit. So we've had some good stories and good successes for students who've been engaging with our therapy dogs.
And you also do the education piece with the canines as well. It's not just responding to crisis.
That's right.
You also have opportunity to use it in other ways too.
Yeah. One of the things that we have found is that our canines are really useful for community engagement. So it's very intimidating to walk up to an officer and start a conversation, right? But it's less intimidating when you have a little dog with a bow in her hair, So like, or this huge fluffy dog walking around campus. That would be Huff, our other therapy canine. He is hard to miss. He's a very big, very fluffy white dog. And so those are the things that draw folks to our officers. And then the next step is the really important part. You can have a conversation with somebody you might not normally have had a conversation with. You know what I mean? It really opens the door and bridges the gap between, those 2 folks and somebody that might be difficult to engage or seem intimidating. You can have a conversation and say, oh, they're kind of just like me, and then you might be able to ask a question that you've been wanting to have an answer to about your safety, about campus, about, things. So that's been a really neat tool that we've kind of learned about and have really seen some benefit from.
One of the most important things in any safety conversation is having the conversation.
Yep.
And starting the conversation and finding a way to start that conversation, especially if it's an uncomfortable topic or something's going on or they have whatever. Having that in really does put you at ease and offers an opportunity, and so that's a fantastic thing. Well, we'll talk a little bit more at the end about how to contact both Reach and Coast again, on how to set something up if you want, if you're in need or something like that. But I do want to get to the third part of a program that we're talking about. And Maggie, you've waited patiently, but I'm going to put you on the spot now a little bit. But the last program is called the Student Patrol Program. And so that is specifically University of Illinois students here in Urbana-Champaign who are employed or connected through the UIPD. So how does that program function? How did you get involved with it?
Usually we found it's like a job on campus, so you can find it on the job site, and it's mostly all University of Illinois students are able to participate in this program, apply for it. And we mostly do like safe walks on campus. We're just extra set of eyes and ears on campus. We work alongside security to make sure everything is working smoothly on campus.
So safe walks, when you say that, somebody might be listening to like, I have no idea what that means. I mean, like safer sidewalks? What are we talking about here? So what is Safe Walks?
So Safe Walks is essentially, it's a program we have where 2 students will walk with any student on campus who feels unsafe, or like staff member, anybody on campus who feels unsafe at night, and we'll walk you to your destination. So you essentially just call the number. I think there's actually the number for it on the back of your iCard, or you can look it up online. And you can call that number. We'll talk to you, find out your location. We'll drop off 2 students to walk with you, and then we'll get you safe to your destination.
Is that available 24/7, or is there?
It's available from 9 p.m. till 2:30 in the morning, and you can call even at 2:29, and we'll still be there. So.
About how many students are involved in this student? Just off, you don't have to have the exact number, but just a ballpark.
There's usually around 10 right now. Every night we usually have at least 2 people walking. So sometimes you might get lucky and you'll get a safe ride instead of a safe walk. But for the most part, we do have like 5 people working at night. So it rotates through.
How long have you been with this student program?
I've been with it since the beginning of this past fall semester.
Okay. So there's opportunity there to also, and that's another opportunity to have those conversations. Mm-hmm. If you're walking with somebody and it's a peer, mm-hmm. it's another student, you might be
We're very much less intimidating than the actual officer.
Somebody might say, have a question, and they ask it, and then you can connect to mm-hmm. another. How long has the student program been going? Do you know offhand, or
I've worked since like the 80s. It's been
I've been here. Yeah.
So it's an established program, and it's got, measurable effect and positive outcomes and things like that.
Yeah, and still one I don't think a lot of people know about.
Well, on the medical side, we run into it here, is that students, 18 to 22 especially, feel a little invincible. Nothing bad's going to happen to me. And so you don't really plan for something that you might need a safe walk because you feel unsafe, or you might need, to call a crisis team because something has happened. Mm-hmm. It's just like, we talk about sickness prevention. I'm not going to get sick, and then you do, and then what do you do? It's kind of the same idea with safety that students may not be aware because they're just not thinking in that direction. They're thinking, what I'm doing Friday night, thinking about my major, whatever it may be. And so that's what we're trying to do, is trying to raise that awareness mm-hmm. in order for people to know that, hey, these are resources you have. I've talked about on how many episodes now that Quad Day is my favorite and least favorite event of all time, because it's great because you see everything that is available. It's awful because you see everything that is available, and we can only process so much, and so you may walk by and see a table even for UIPD and go, oh yeah, but 3 months down the road, are you going to remember that? And that's what we're trying to do, is bring that familiarity back. I could just say my own existence. When I was a student here in '96, I lived at Hendrick House, which is corner of Green and Lincoln. I never came to McKinley. I didn't know McKinley existed. Yeah. I was 2 blocks away. I had seen it. It was in my paperwork. I know it was, but I didn't know it was here because it just got lost in the shuffle. So we try and bring things back up as we go and get things set up. So that's really what it is trying to make people aware. So with that, for all these things, Coast, student program, Safe Walks, Reach, how do students find out more information if they need to contact you or whatever? They want to set up a training, whether it's an RSO or, somebody on campus who wants to set up some sort of training. How do they get in touch with you?
I'm going to go and say what me as someone who was in that situation too, where you're getting bombarded by so much information. I'm going to just say this, any questions related to UIPD, Coast, Reach, any type of student patrol resources you're looking for, just call the non-emergency UIPD number 217-333-1216. I believe that is the one on the back of the iCard. They will be able to direct you to any of those entities, point you in the right direction there. So rather than worried about direct numbers for all these different things, the TCs there could even, if it is something you needed uniquely, like you were seeking Megan or looking for myself, they can direct you from there right to our personal cells, anything like that. So that's kind of, I think, the best approach to just when in doubt, just call that number and tell them what you're looking for, and they'll be able to direct you.
And what is the UIPD website? Do you know that offhand?
There you go.
police.illinois.edu.
There you go. We will have the link to that website and the link to the and list the phone number in the bio of this episode as always, so you can find those resources there. So you have more questions, that's the best place to start, and you can get directed wherever. Because again, the people who are on campus want to help you have the best experience you can have on campus. And so if there's no question that is going to be ridiculous, just call and ask, and you'll get an answer. It may be an in-depth answer. It may be something that's answered quickly. It just depends on the situation. But those resources will be there as well. Guys, thank you so much. And time flies always. But there was a lot of information there, but it was all fantastic information. And again, I appreciate you taking the time to come today and share about the programs you're involved in, the ways that you're trying to help keep our campus safe. So thank you so much.
Yeah,
Thanks for having us.
Our campus is large. It's a big campus. It's a beautiful campus. And I like to think of it as a safe campus. But there are moments that happen, and it's always good to prepare yourself and to know what to do in case of an emergency, whatever it may be. And UIPD is here to help with that as well. So check out their resources, contact them, go to any of the trainings they have that you can be involved in, any of the outreach things they're doing, talk to a student patrol member, find out what their experience is. If you want to be a part of that program, check it out. But there's a lot of resources here through UIPD that are here to keep you safe, are here to help you have the best experience you can have. If you have any questions on this topic, if you want to continue the conversation, you want to give some feedback, contact us at Healthy Illini. Contact me at McKinley. I'm happy to talk with you. We want to know what your response is. We want to know what your thoughts are. We want to know what questions you have, because we want to help you have the best experience you can possibly have. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.